LD Pinky said you can't sell a product if it's not sitting on the shelf. So many dental students graduate $500,000 in debt thinking they're going to be able to pay it off by doing just simple things like cleaning, exams, x-rays, and fillings, and simple single unit crowns. You know what's not on their shelves? Getting people out of pain. Dentistry started out and still stands on treating the proverbial toothache. It's also where all the big money is. Molar root canals, extractions, replacing that extraction with a dental implant. Coming out of dental school, many young dentists won't attempt a molar root canal, and 95% won't place an implant. But if you're not capable of doing single tooth extractions and replacing them with an implant, or doing a root canal buildup and crown, you're putting your practice in financial trouble. The saying, become proficient, not just prolific, emphasizes the importance of focusing on quality over quantity. It suggests that being skilled and competent in what you do, proficient, is more valuable than simply producing a lot of output, prolific, without mastery or excellence. If you're learning to play the piano, don't just aim to play many songs prolific. Instead, focus on playing a few songs exceptionally well, proficient. This is why all the dentists who earn their FAGD and MAGD produce and collect so much more than the average dentist. I think the sweet spot to baller money in dentistry is taking over 100 hours of continuing education per year. On a recent road trip, I stopped in to see Dr. Jake Wolf, who owns Oregon Mountain Dental in Las Cruces, New Mexico. This townie, who has placed more than 1,500 implants, says placing a single implant on a healed ridge is maybe the easiest procedure in dentistry. Sure, it can be complex, he says, but it doesn't need to be, thanks to equipment like drill stops and surgical guides. Dr. Wolf, who's been giving other dentists hands-on instructions on how to place implants in their own practice, says he believes that most younger dentists get into trouble when they attempt advanced work because they skip a lot of steps in training. They don't know how to prep a crown, yet they're asking about which full mouth rehab courses they should take. Or they've never placed an implant before, but want to learn how to do all-on-4 cases. Something like all-on-4 is not something a dentist should just be dabbling in. Doing one every 6 months, it's something you should save for people who are set up to do that type of work efficiently and productively and routinely. Instead, you should know that if a patient shows up in your practice with a toothache on number 19, you can treat that tooth in one visit. Get your workflow down for the stuff you're going to do every day. Procedures that your patients need that you can make a living doing. Most of the exceptional dentists I know who have tons of experience with all-in-4 cases, started out by buying a big denture clinic. First they added 2 implants for a lower snap-on denture, or 2 implants for a dolder bar. And 10 years later, they were placing all-on-4 level cases routinely. Patients are customers, and you've got competition. I hear so many dentists of all ages who still have an attitude about what I just mentioned. A patient just allowed to walk in and expect me to treat them even if they don't have an appointment? Where's this judgment coming from? For one thing, you're a doctor and they're a patient. It's literally your job to help them. In an era where you're likely got 2 dentists right down the street from you, do you think anyone's going to wait a week or 2 in pain until the time that most convenient for you? If you were suffering, would you wait a week or 2 to be treated? Same-day emergency dental appointments and same-day dentistry are the hallmark foundation of $1 million practice. They call up on the phone with an emergency. You know the hospital has an emergency room, right? So why don't you have an emergency operatory? When you do a hygiene check and the patient needs a filling or a crown, you always offer to do it right now? The patient doesn't want to come back. They don't want to miss work, get their kid out of school. You have to add dental operatories until you're poised for growth. If you don't have room for adding another dental operatory, I've got an idea. Why not convert the doctor's private office into an operatory? Superman worked out of a phone booth. Why can't you? Your attitude determines your altitude and your aptitude. It's essential that you become comfortable performing this bread and butter dentistry, the procedures that keep your practice open and profitable, so you can keep your patients happy and healthy. And it's essential that you remember that dentistry is a service business. If those patients aren't happy at your practice, they'll seek out another practice instead. So lose the bad attitude and increase your aptitude. If you enjoyed this episode of Howard Speaks, please subscribe, share, and comment below. I do read all of your comments. I appreciate you, your thoughts, and support. So be good and have a rocking great day.